32 million Americans are losing their joints right now, silently, painlessly, with absolutely no warning. The cartilage that cushions every joint in your body is being worn away day by day, and by the time the pain becomes unbearable, up to 60% of it is already gone forever. Today I am going to show you exactly what osteoarthritis is, why it destroys your joints for years before you feel anything, the 7 silent signs your joints are already breaking down right now, and the one thing most people do every single day that is making it dramatically worse. Sign number 4 shocks everyone because most people believe it is actually helping their joints when it is quietly destroying them. Your joints are protected by cartilage, a smooth, rubbery tissue that covers the ends of your bones, acting as a shock absorber, allowing your knees, hips, hands, and spine to move smoothly without bone grinding against bone. Osteoarthritis happens when that cartilage gradually breaks down. Unlike most tissues in your body, cartilage has no blood supply. It cannot repair itself. Once it is gone forever. And here is what makes osteoarthritis so dangerous: a cartilage has no nerve endings. It feels nothing. It sends no pain signals as it wears away. You feel nothing until the cartilage is almost completely gone and bone begins grinding directly against bone. By that point, the damage is permanent. Here are the 7 signs your joints are silently breaking down right now. Warning sign number 1: morning stiffness that takes more than 30 minutes to go away. You wake up and your knees, fingers, or hips feel locked and stiff. After 10, 20, even 30 minutes of moving around, they loosen up. Most people chalk this up to age or a bad mattress. But this morning stiffness is your joints telling you that the synovial fluid, the lubricating oil of your joints, is no longer doing its job properly. As cartilage breaks down, synovial fluid becomes less effective, causing that stuck, stiff feeling every single morning that gets progressively worse each year. Warning sign number 2: a clicking, cracking, or grinding sound in your joints. Your knee cracks when you stand up. Your hip pops when you climb stairs. Your fingers crack when you bend them. Most people ignore these sounds completely, or even find them satisfying. But these sounds, called crepitus, are the sound of damaged cartilage surfaces grinding against each other. In a healthy joint, movement is completely silent. Cartilage is so smooth that bones glide without any sound whatsoever. Any consistent clicking or grinding in a joint during normal movement is a sign that cartilage is already damaged. Warning sign number 3: joint pain that is worse after activity and better with rest. This is the signature pain pattern of osteoarthritis, and what separates it from other joint conditions. With osteoarthritis, the joint hurts more after you use it. After a long walk, your knee aches. After gardening, your hands throb. After sitting for a long time and then standing, your hips protest. But after resting, the pain improves. This activity-related pain pattern is your damaged cartilage unable to absorb the mechanical stress of movement, allowing that stress to transmit directly to the underlying bone. Warning sign number 4, and this is the one that shocks people: pain that gets worse in cold or rainy weather. Most people believe this is an old wives' tale. It is not. Barometric pressure, the atmospheric pressure in the air around you, drops before rain and cold fronts arrive. When pressure drops, the tissues around your joints expand slightly. In a healthy joint, this causes nothing. In a joint with damaged cartilage and inflamed tissue, this expansion creates noticeable pain and stiffness. Studies confirm that people with osteoarthritis can predict weather changes with remarkable accuracy, not because they are imagining it, but because their damaged joints are genuinely sensitive to pressure changes that healthy joints simply do not register. Warning sign number 5: swelling around a joint that comes and goes. When cartilage breaks down, fragments and debris accumulate in the joint space, triggering the body's inflammatory response. The joint lining, the synovium, becomes irritated and produces excess fluid. The result is a puffy, slightly swollen joint, particularly around the knee, that comes after activity and goes with rest. Many people notice their knee looks puffier in the evening than in the morning. This cyclical swelling is not innocent water retention. It is your joint's inflammatory response to ongoing cartilage destruction. Warning sign number 6: a feeling that your joint might give way or buckle. You are walking downstairs and your knee suddenly feels unreliable, like it might give out. You reach for something and your grip unexpectedly fails. This happens because as cartilage wears away, the joint becomes mechanically unstable. The muscles and ligaments surrounding it struggle to compensate for the lost cushioning, creating a sensation of weakness and unreliability in the joint. Many people with early osteoarthritis describe this as a lack of confidence in their joints, particularly on uneven ground or when changing direction quickly. Warning sign number 7: reduced range of motion that has gradually shrunk over months or years. You used to be able to bend your knee completely. Now 90 degrees is a struggle. You used to turn your head fully left and right. Now there is a point where it simply stops. This gradual, progressive loss of range is your joint capsule, the tissue surrounding the joint, tightening and thickening in response to ongoing inflammation and cartilage loss. Most people adapt to it so gradually that they do not notice until they try to do something they used to do easily and find they simply cannot. Now, the one thing most people do every single day that makes osteoarthritis dramatically worse: sitting for long periods without moving. When you sit still, synovial fluid stops circulating through your joint, starving the cartilage of the nutrients it needs to survive. Cartilage has no blood supply, it gets all its nutrition from synovial fluid moving through it during movement. Every hour you sit completely still, your cartilage is being starved. The single most powerful thing you can do for your joints today costs nothing. Stand up every 30 minutes and move for 2 minutes. Walk, stretch, cycle, swim, any low-impact movement that circulates synovial fluid through your joints and delivers the nutrition your cartilage cannot live without. There is no cure for osteoarthritis, but there is a massive difference between osteoarthritis that is managed well and osteoarthritis that is ignored. Exercise, weight management, anti-inflammatory foods, and early medical intervention can slow the progression dramatically, preserving your joints and your independence for decades longer. But only if you catch the signs early. Only if you act before the cartilage is gone. If this video helped you, share it right now with someone who complains of stiff joints in the morning or aching knees after walking. They may be losing cartilage right now without knowing it. Subscribe and hit the bell, because in my next video I am going to reveal the disease that is silently attacking your immune system right now, causing your own body to destroy itself from the inside, and the 6 warning signs that appear years before a diagnosis is ever made.